Today I want to talk about decompression for stenosis in the cervical spine. This stenosis is narrowing of the canal where the spinal cord passes. So the spinal cord is being compressed, and due to that compression, the spinal cord is deprived of its blood supply. And you start losing cells over time because of that diminished blood supply. So when we operate for spinal cord compression, we're not operating to make you better, we're operating to keep it from getting worse. And so by getting the pressure off the spinal cord, we reestablish blood supply to the spinal cord. Whatever cells you've lost from the compression are lost. But generally there's some improvement, but the primary purpose is to keep it from getting worse. That procedure can be done either from the front or the back, depending on the number of levels involved. If it's done from the front, it involves removing a combination of vertebrae and discs that have to be reconstructed. The discs and the vertebrae provide mechanical support for the spine that has to be reconstructed for. And in doing so, where the disc or vertebrae is now a polymer that carries bone that will actually grow and be living tissue that welds the vertebrae together. And that process of bone growth is accelerated by having a plate in the front. This functions as an internal cast. The young cells in the fusion do not like motion and movement, and so resisting motion and movement with a brace externally and a plate internally is how we help those bone cells grow bone optimally.